if the head of the stream is corrupt, the entire river will be also.
Loyal viewers on the Avenue, give thanks for life. Give thanks for your continued support. New viewers, forward to the Avenue. Don't forget to watch the videos. Leave your comment in the comment section. Like and share. Subscribe to the channel. Thank you very much. Today, we will be looking at Enfield resident highlighting Dr. Dunn work throughout the constituency, and we will be looking at Senator Scott-Mottley explaining why the opposition did have to bring the government to court, and Dr. Guy and Dr. Tufton both will explain the state of our health sector. Some people, let's get into it and hear what they got to say, and in the meantime, leave your thoughts and views in the comment section and let us have that discussion. Don't forget to like and share.
People, good morning. We're in a southeast St. Mary at a district near Enfield. We're at the community center, and we have a man like Norman Dunn. All right, and this district here, we have almost 3,000 people live around here. Look on the community center. I think the people of Enfield deserve much more better than this, Mr. Norman Dunn. Look here. Look on the facility. I have almost 3,000 people live around here. And look on the facility. And we have an MP like Norman Dunn. Look here. Look on the window of them people. Look here. My God have mercy. And we have so much vote around here, but now we are run come try to fix basketball coach. The coach all Ilangoli. The field all Ilangoli. Look on the field. He have a snoop in it. He post a lever. He not even do good. But look on the Enfield community center. Look on the window them. Look at the community center. All right? That's what we are talking about. The people of Enfield deserve better. All right? We want a better NP and Norman Dunn. Look here. You have cardboard at the window. And we have an MP like Norman Dunn in a southeast St. Mary. You get what I'm saying to you? We have an MP like Norman Dunn, you know? And look on the facility right here. People look for themselves, you know? Camera don't lie. Look for yourself. Look here. Look at the place. Whisk, grow, I take it over. And we have a man like Dunn that about empty barrel. There is no empty barrel done. Because the camera don't lie. See it? Look. We're seeing the people. The NP people want better. And people want to go vote and vote for Norman Dunn. You're begging them. And then Chris Brown come with the same thing. We'll get rid of Chris Brown. The people of NP deserve better, man. Come on, Mr. Dunn. You're what's all over the ceiling up there. So look at it. Come on, people can't have a place like this when it's a lockdown like this done. And we have a man like you, like MP for 7 years. We are doing for the people of Enfield. You run Cremona because election and come here and give a chicken and all this. But people take the chicken and take the vote for them. I want to go to the vote. I want to go to the voting poll and vote out Norman Dunn. And that will say. Alright? I want to vote him out. The people of Enfield deserve better. We are there all these years. Now the election call you run Cremona here. I fix all these things. Look on this way fix. And we say we're going to do it, you know. And you're going to do it. Look on this thing there, man. Like a waterfall. Look on it. He don't even level. Look on it. People look on this window. He don't even level. He go up the hill like this. To show you the bad work when Norman Dunn do. I never come and inspect it before. I guess I him tell him to do them so. You feel me? I said to you, but we need a better community center Norman Dunn. Shame on you, Dunn. Shame on you. And people if go across southeast St. Mary. The one in Dover as well locked down. The one in Luna as well locked down. The two of them in the Lewis store locked down. The one at Cassiton locked down. The one at Richmond, all them locked down. And the watchdog we have, the Norman Dunn, the MP for Southeast St. Mary. Shame on you, Mr. Dunn. Shame on you. So people, there is no empty barrel because the camera do not lie. So Mr. Dunn, you need to apologize. I'm sorry for you. Because you're not going to win the election about here. Alright, so you can make all the plans they don't want. But people, the camera don't lie. Alright? So Mr. Dunn, don't talk with your talk, sir, alright? Take back your talk. Boy, empty barrel meant nice. There's no empty barrel around here. Camera don't lie. So people, when they go to the poll for the vote, when they decide what they want for the future and for the kids them as well. Alright? We have a play for you. What play for you, sir? Eh? This should fix up real nice and fence up and keep out the cow them out here. You feel me? But don't care about it, no. Don't care about the vote. Now you are grown, you have fixed this, you have fixed that. Come on, Mr. Dunn, man. Come on, you need a good advisor. The advisor we have around you is no good. Look on the Enfield playfield. Yeah? Like a cow pen. The people of Enfield deserve better done. And the camera don't lie. So when you say empty barrel, you need to be careful what you say about empty barrel, because there's no empty barrel around here. Nah, man, dunce. Alright? So people see for themselves. Camera don't lie. Peace out.
Now thus you hear what this resident got to say, my people, and you see what he stated on the video. What is your thoughts on this? Do you think Dr. Dunn deserve the third term that they are going for? So my people, leave your thoughts and views in the comment section. Let us have that discussion. So now my people, Senator Scott-Mottley will explain in this one why the opposition did have to bring the government to court, and in this one she give a lot of details. So let's get into it and hear what she got to say, my people.
Those are the comrades who will be leading us into victory. But victory cannot be achieved unless you, the comrades of this noble party, are there stepping along with us, holding our hands and guiding us, because without you, there is no we. I salute you, comrades, because just as the wind is blowing now, there's a wind of change blowing through Jamaica. Everywhere there's a wind of change. Every community in Jamaica, when you go there and you see the comrades, your heart overflow, because they are ready. They are ready to get out and mark their X. They are ready for a change in this country. And comrades, when I come to you tonight, I come to you with the DNA of the People's National Party. I come to you in the spirit of Norman Washington Manley. Norman Washington Manley, who founded this party, was a man who went into politics as a rich lawyer. And when he left politics, he was broke. And you know why? He had integrity. He came to serve. He reflected every one of you in front of me, serving with dignity, with the people at the center of his heart, always putting the people first. And when you look at our leader here on this platform, you see reflected in him, reflected in all of our candidates, the DNA of Norman Washington Manley. We don't have no jackets in the PNP. In the PNP, we have no jackets. We have people who are committed to building a Jamaica that works for all of us. Let me spend a minute telling you about the government now leads us. I tell you that without justice there can be no peace, because each one of you must feel that the party that leads you treats you with respect, sees you and leads you with dignity. When we talk about the Constitution, we are talking about your rights. We are talking about your power. We are talking about your authority. And these people, all they do every day is break the Constitution. If they did listen to us as PNP, they wouldn't broke it, so you know. Because when they were doing needs, we sat in the Senate until 1:20 Saturday morning, because we were trying to correct them and to tell them that what they were doing was against the Constitution. They never listen. So what we do? We just take them to court and win it. When we told them, when our leader told them that states of emergencies were illegal, them never listen. So what we do? We just take them to court and win it. Every time they break the Constitution, PNP steps in to protect the people. We don't want any dictatorship in this country. We want somebody who can be certified to lead us. And I want to say this because I know you have to listen to your MP and you have to listen to your leader. I just want to ask one dege question. You know what a dege is? One dege question. I noticed that Parliament was scheduled to end on July 2nd. And suddenly now everything rush up and Parliament is ending on the 24th of June. You see, the Integrity Commission report, which disclosed that 8 of them were under investigation for illicit enrichment, under the law must be tabled by the 30th of June. What are they hiding from? Why are they locking down the Parliament before the 30th of June when they had planned for the 2nd of July? What can go so? But we the people with the power in our might, we the people with the power in our hand, we the people with the power in our fist will tell them time come. Your time come. It done now. Make way for a leader with integrity. Make way for a government who puts people first. Make way for a government who says time come for Jamaica, for all of us. The word is love.
Now let us look at this, what this JLP member stated about Christopher Tufton handling of the coronavirus crisis in Jamaica, my people. And look at this and tell me if it equates to what she's saying.
We wondered how he managed COVID. And tonight we use this platform to salute Dr. Christopher Tufton for his management of the COVID-19. And no matter how the opposition try to tear him apart, we know that the health sector is in good hands with Dr. Christopher.
Because this is the same man who stated that the people should take the vaccine instead of the water. When we all know water is life, my people. So let's get into it and hear what he got to say and leave your thoughts and views in the comment section, my people. Let us have that honest discussion. Thank you.
Hello. We
don't want no vaccine.
Now listen to our health minister on this platform with his ranting of lies and misinformation and propaganda, my people, and tell me what you think of this. Leave your thoughts and comment in the comment section and let us have that discussion. Now, my people.
Tufton.
I want to say a few things. And I want to say a few things from the perspective of Minister of Health and Wellness. And I want you to listen to me carefully, because this is serious talk. We have a serious decision to make not too long from now. And the message must be very clear, must be very simple, must be very straightforward. The orange people them like to talk about crisis in public health. Well, I want to talk to you about what crisis mean, because them clearly don't understand the meaning of crisis. Crisis was on November 6, 2015, when Portia Simpson Miller fired Fenton Ferguson for incompetence and non-performance and appointed my good friend Harris Daly as the next Minister of Health. The country was facing a crisis at that time. It was a crisis of confidence in the Portia Simpson-led administration and in the Minister of Health of the day. She had no choice but to get rid of him to appoint another person. And guess what? I and I there for the last 9+ years. The people of Jamaica still have confidence in me. And Andrew Holness as Prime Minister still have confidence in me. We don't have no crisis that they had back in 2015 on November 6th. And you know, there are many other good definitions of crisis that the PNP need to understand and the Jamaican people need to appreciate. Crisis was when Shackleton Hospital was shut down and the people of Northern Clarendon never had the services of a hospital until Andrew Holness took over and I as Minister of Health and Wellness, and after $300 million of expenditure, Shackleton Hospital is now open to the people of Northern Clarendon. New pharmacy, new operating theatre, A&E, 50 beds for inpatient care. We have solved the crisis that they created. We never create the crisis. We solve it. And that's what Labour Party do. We solve crisis. PNP create crisis. Remember that. Crisis is Lionel Town Hospital in 2015. Lacking resources. Dog, pig, cow, goat used to walk and roam the compound and compete for space with the doctors, the nurses, and the patients. When we took over, we spent $100 million and perimeter fence the Lionel Town Hospital.
But Mr. Tufton, in this Observer newspaper, it shows us here where the Lionel Town Hospital was fenced for $38.9 million, sir. So what are you saying to us? Which one is the truth?
Town Hospital had more doctors and nurses, and the people of Southern Clarendon are getting much better support because of that. We solved the crisis that the PNP support that created. And I could go further. I could talk about crisis in primary health care. Because Enfield Health Sector, Thompson Town Health Sector, Raymond's, Kelly's, Anion Town, Tollgate, over $70 million that this Labour Party spent to renovate, improve, and enhance the services of those health centers because they were in a crisis when the PNP left office back in 2016. That is crisis. But I'm not finished yet. And I really want to reason with you about crisis because them use the word loosely, as if they understand what crisis is. Crisis. All right. No, I haven't thought that one here. Crisis is when a Jamaican have cancer, colorectal cancer, multiple myeloma, lung cancer. In 2015, they had no support. We came, we solved that crisis through the NHF. Any Jamaican unfortunate to have those cancers can now get medication free under the National Health Fund. We solve crisis, they create crisis. You know, I'm going to make the final comment and then sit down. Because the PNP don't understand what crisis is. And they want to trick you. They lie in the morning They lie at noon and they lie at night to give an impression that somehow the health system is in crisis. The health system is better off today than it has ever been. We still have work to do, but this government is making more progress than any time before. Imagine, I go to Parliament and I tell the public with data that we have spent $9.4 billion on Cornwall Regional. The next day, Mark Golding go to Wolaba and tell the people, say $24 billion we spent on Cornwall. Them lie in the morning, them lie at noon, and them lie at night. They don't know the difference between truth and fiction. That is the crisis, a crisis of confidence. We cannot afford them to come and to reign over this country, because guess what? They would put us in more crisis. So labor rights.
This is the truth to what Christopher Tufton was speaking about, and listen to Dr. Guy explaining it all to Christopher Tufton in the Parliament, and tell me who is more truthful or who is speaking the truth, Christopher Tufton on a political platform or Dr. Guy in the Parliament. Leave your thoughts and views in the comment section and let us have that discussion. Let us get into it, my people.
Madam Speaker, Mr. Speaker, I speak today not only to contribute to this annual sectoral debate about health and wellness and education, but as a proud Jamaican deeply concerned for the state of our nation's public health. Yes, Minister. The system stands at a crossroads, battered by neglect, inefficiency, waste, and lack of meaningful accountability. Despite the spirited defense given a week ago, the reality is that Jamaica's public health system is at a critical breakpoint. Equipment failures, industrial action at every level of staff, overcrowded, deteriorating facilities have become the daily reality for our people. Many Jamaicans visiting hospitals for needed or emergency care have spent days and weeks fighting to be accommodated with a bed. Some have been forced to remain on stretchers, in wheelchairs, on chairs and benches, and yet others have had to make cold ground their bed, even if not rock stone their pillow. Minister, you must be aware of these situations, which are not limited and were not limited to the COVID pandemic period. Neither are they limited to any particular institution, urban or rural, whether type A, B, or C. In all of them it exists. The government's focus on public relations, Chris, and optics, rather than the actual delivery of services, push the sector to the brink of collapse. Each week, we see or hear of another grieving family, another life lost, another tragedy that could have been prevented. And you know, Mr. Speaker, with glee, the minister in berating the previous government handling of health pointed to a newspaper article of 2015 which mentioned, and I quote, doctors use plastic bags as aprons in operating theatres, unquote. This doesn't happen nowadays. You know, Minister, that don't happen. At least we haven't heard about it. But what happens, Mr. Speaker, is that surgeries are aborted because of the absence of even theatre linen. And we only could look at what happened in Notre Bay the other day in a TVJ expose in June 3, 2025. Because of the absence of functioning theatres, because theatres have become mold infested and out of commission. At least in 2015, patients were getting the much needed surgery with the aprons from plastic bag. One cannot say the same for today. Mr. Speaker, this is not just a crisis of infrastructure, but a crisis of leadership and compassion. Madam Speaker, nothing highlights, Mr. Speaker, I'm sorry, this crisis more starkly than the recent procurement scandal involving the $31 million drill. The matter is before the court, so we're not going to go into specific details here. Suffice it to say, $31 million is money that could have been used to purchase a drill and life-saving medications, repair broken equipment, or hire much-needed staff. We must question the value for money proposition and assert only that accountability is needed in the system. The country is asking and demanding answers. We join them. We demand a full and independent investigation Tell the people of Jamaica how their money is being spent, and those responsible must be held to account. This, Mr. Speaker, is not a time for excuses. This is a time for action. The government must act decisively to restore trust and ensure that every dollar spent on healthcare delivers real value for money to the people of Jamaica. Mr. Speaker, the Cornwall Regional Hospital is the saddest situation in the public health system and represents a continuing crisis. And you, Mr. Speaker, more than anybody else knows about that. It affects your constituency. It has affected the entire Western Jamaica for nearly a decade. People of 5 parishes have no access to health care, proper health care at the only Type A facility in that part of Jamaica. The closure or limited operation began in 2016, as we all know, due to complaints of noxious fumes. And Jamaica remains without a firm date for completion of the engineering and construction work, and without a date for the reopening and provision of full services the public expects from a Type A facility. You know, Mr. Speaker, during the sectoral presentation, the Minister was at pains to somehow minimize the humongous bill which the project has also cost taxpayers money, and which is also in all likelihood is still unknown, as the completion was pushed back only days before he spoke. How could the Minister attempt to portray that the Cornwall Regional Hospital project has been anything but a complete disaster for the people of Jamaica, especially those needing health care? But Madam Speaker, Mr. Speaker, we know election is in the air, when for the first time publicly we hear the Minister expressing some remorse and being sorry for the debacle at Cornwall Regional Hospital. Mr. Speaker, it is disingenuous of the Minister to come here and speak about the 9.4 billion, I use in your word, already spent for fees, construction and equipment, without acknowledging that the estimates of expenditure, and I have it right here, Mr. Speaker, this book, 26 billion, prepared and presented by his government and Ministry of Finance, had projected the total cost to almost 23 billion. In fact, Mr. Speaker, 21.4, which is in this book, for 25-26. But guess what? The Minister decided to tag on another 2.1, as was indicated by him at the opening of the administrative block in April 2025. Here, government touts 23.5 Cornwall Regional Hospital overhaul. These numbers were not created by the opposition. These are your numbers, Minister. And I challenge you to indicate where any member of the opposition speaking on any platform has indicated the figure is 26 or 27, as you alluded to. In fact, Mr. Speaker, we have had over the years expressed concerns about the continuing cost escalation, which at times seem to have had no end. I remember in 2021 I said it was going to cost 10. The Minister scoffed at it, he rubbished it and said, I don't know where my colleague got those figures from, but I'm going to have a talk with him about it to find out how he came by those. Which at times, Mr. Speaker, seem to have moved from single-digit billions to this whopping number. We have even visited the site to see firsthand and to highlight the concern. So after almost 10 years, several numbers providing annual estimates, and your sectoral address last week, my question is, Minister, do you really know the number?
As you can hear, my people, that's all for now. What is your thoughts and views on all of this? Leave them in the comment section and let us have that discussion. If you are new here, forward to the avenue. Don't forget to like, share and subscribe to the channel and watch the videos. Thank you very much. Catch you in the next one. I'm out for now.